Drowning is known as the respiratory impairment from being in or under a liquid. It is sometimes separated between drowning and near drowning, with drowning ending in death. There are a couple different types of drowning. Wet drowning occurs when fluid is aspirated into the lungs. Drowning can occur as a primary event or occur due to various secondary events. Drowning as a primary event in infants most commonly occurs in bathtubs, in children ages 1 to 5 in residential pools, and in young adults most commonly occurs in natural bodies of water such as ponds, lakes, oceans, and rivers. Drowning is commonly associated with various secondary events as well. Seizures, head or spine injuries, cardiac arrhythmias, and alcohol and drug ingestion are the most common.
A victim of wet drowning may or may not be responsive after being removed from the water. Other signs and symptoms of wet drowning may include cyanosis and cold skin due to lack of circulation, abdominal swelling, coughing, vomiting, and shortness or lack of breath. Drowning is the third leading cause of accidental death, causing around 3,536 fatalities per year. Drowning victims are most likely to be young children, usually around the age of 4, or young adult males around age 15 to 19. The most common setting for drowning is a rural area in the southern or western United States, usually on a weekend between the summertime months of May through August.
Several organs are affected by wet drowning. A person drowning most likely will first begin to panic, leading to rapid and large movements, expending energy and oxygen. Once the person becomes unconscious, the throat relaxes and allows water to flow into the lung. Accumulation of carbon dioxide in your body leads to involuntary draws in breath, ultimately causing to swallow more water into the stomach. After all, majority of the organs will be affected as the osmotic balance of one's bloodstream will be off, depending whether it was fresh water or seawater.
These are the things to take into account during your primary assessment of the drowning victim. Is the patient responsive? Are they injured? Do I need to move them? Do the conditions of the water pose a threat to me as a first responder? Is the water cold enough to lower the body temperature of the victim? How many rescuers are on the scene? Reach. Hold out an object such as a towel or rope for the victim to grab. Throw. If the victim is too far away, throw an object that floats to reach the victim. Row. If the victim is too far away to reach or throw an object, use a boat to get closer. Go. Swim to the patient if no other options are available.
Scene safety hazards include fast-moving water, sharp drop-offs, and underwater entanglements. Personal protective equipment in this situation include a mask, gloves, and a life jacket. The patient assessment is crucial for determining which method of care to provide to the victim. Get next to the victim. Extend the victim's arms straight up alongside the head. Press arms against the head to create a splint. Rotate the patient by bringing the farthest hand toward you and pushing away the hand that is closest. Rotate the patient. Lower yourself until the water is at shoulder level. Maintain stabilization of the patient's head and support the patient's lower back until help arrives.
Position yourself next to the victim. Position one arm along the victim's spine, supporting the head with your hand. Place the other arm along the patient's chest, supporting the mandible with your hand. Rotate the victim by ducking under the body. Continue to maintain instabilization until a backboard is used to immobilize the spine.
Immediately call 911 if the victim is unresponsive. Check ABCs for at least 5 seconds, but no longer than 10 seconds. CPR and rescue breathing are dependent on what you as a first responder find while checking ABCs. Remember to adjust care based on the patient's age. Determining the level of consciousness will determine which course of action to do. This diagnosis will instruct the first responder whether or not to remove the victim from the water, and if so, which method to use. If you do not have an airway, you do not have a patient. Open or establish an airway and prepare for ventilations. Make sure to watch the chest to see if it rises.
The ultimate prognosis of drowning depends on the duration and magnitude of hypoxia. The faster the patient receives resuscitation, the better chance of survival. Long-term effects of drowning include acute to severe neurological damage. Although it is poorly understood, drowning in cold water has shown to have neuroprotective effects as compared to warm water. In cold water, the body can become hypothermic. One of the body's protective mechanisms during hypothermia is reduced need for oxygen. Therefore, patients who drown in cold water and become hypothermic tend to have lower rates of neurological impairments. As a general rule, patients who are not doing better within 24 hours usually have severe neurological damage.
Drowning can result in a multitude of non-pulmonary infections, for example, brain abscesses, osteomyelitis, or soft tissue infections due to contaminated water. Oftentimes, this can be treated with antibiotics. Drowning can also result in severe neurological impairment depending on conditions such as how long the victim was unconscious before being resuscitated or how long the victim was in a coma. If this is the case, the victim may need aggressive rehabilitation at a rehab facility.